Hi everyone, my name is Carmen and I have been a maternity nurse for 4 years now, and my project will be about postpartum hemorrhage in a formative escape room. Um, so basically, background information about my project is the escape room will include medications and procedures that should take place during a postpartum hemorrhage. For example, the students will have to retrieve hemorrhage medications from the Omnicell that they must be able to show the specific way to be able to pull all the hemorrhage meds to bring back to the room. The participants will have 30 minutes to complete the escape room. But right before they enter into the room, there's going to be a small prompt about our patient, her history, her G's and P's, about her labor, about her pregnancy, and a few things to kind of like trick the students a little bit into having them think outside the box. And there'll also be rules placed saying that they have 30 minutes to complete the escape room. If you ask any questions, 5 minutes will be deducted. Everything will be found on the unit. They don't have to go to other units, but clues will be found scattered throughout the unit. And if they need to have stop and ask questions and discuss something, I also put that to say we can stop and ask questions, because it's a safe environment for them, especially new nurses, to ask questions. So I think it's going to work out really well. In the article by Kennington and Moore, the explanation to use an escape room in a medical setting showed that participants really enjoyed learning and being able to have that critical thinking skills with each other, as opposed to taking like a written test or just watching a PowerPoint. It's more interactive and more hands-on for the students to be able to learn. The participants will consist of new and experienced nurses. Each year, my unit, we hold annual competencies and mock drills for the staff members to get checked off on. These will include postpartum hemorrhage, eclamptic seizures, a shoulder dystocia, having to resuscitate an infant after delivery. We hold these so people are able to practice and feel comfortable, so when the time comes to really perform these skills, they feel better equipped to do so. The escape room will have 5 participants in each section. So we announced the other day to our staff and gave them the dates. Due to COVID, we can only have about 5 people in each escape room, which is fine. We just will hold a lot of escape rooms. 5 is a good number because then that way everybody is, interacting, participating, and we don't feel like we are having to point people out to say, hey, you're not doing anything. So 5 is a good number, and I like 5, so it'll work really well. Especially because the escape room will take place in a patient's room, empty patient's room, and everything, it'll look like a delivery just occurred, so it'll be a little messy, and I kind of want it to look a little chaotic, so that way, everything's not going to be nice and smooth sailing when this happens in real life. So you kind of have to have somewhat of real life situations played in as well. A postpartum hemorrhage can occur after the delivery of an infant, right after delivery and up to 24 hours. We are monitoring mom's bleeding right after she delivers, but it's really important for, when it comes time to get the mom up to use the restroom after delivery. If she went natural or if she had an epidural, we need to assess to make sure she feels okay. She doesn't feel lightheaded, her blood pressure is okay. If we rub on her fundus to make sure that her bleeding is under control, and she doesn't pass large clots. Things like that. We just want our students to really understand and think, okay, is now a good time to get her up? Because we don't want anybody falling or passing out in the bathroom on us or getting them up to the chair and they fall. So this is something that we really want to be able to educate our staff on, the importance of understanding the severity of what can happen during a postpartum hemorrhage, and it may not always occur right after delivery. It can occur 4 hours after delivery. So the theoretical theory that I will use with my innovation project will be the information process theory. The escape room will provide participants clues to prompt them to the next clue in the escape room. So in relation to the information processing theory, this theory deals with problem solving and creative decision making for the person to think about and be able to use their critical thinking skills to understand where they need to go next, what they need to assess next, what needs to be evaluated after that assessment is completed. The individual will have to apply their knowledge to navigate through the escape room. Granted, they're going to be in a group, so 5 brains are better than 1, especially when an emergency occurs. You're never by yourself, so I think that's important to tell our new and experienced nurses that are new to our unit. You're never by yourself when an emergency occurs. There's a staff assist button. You can call out. The doctor's going to be there with you right away if you have any hesitation. And I think that's really important for them to know, when do I call the doctor? How much blood is too much blood? Her blood pressure, is this her norm? If they were just given the patient from another nurse, if they need to understand their baseline, maybe their baseline has changed from the previous nurse, and it's very important to really catch up on those details. So like I said before, this will be an open discussion. If we need to stop and take a few questions and just kind of talk things through, but I really want them to be able to work through it as much as they can. So in relation to the new nurses, they really need to understand the hemorrhage medications that they can give to their patient after delivery, or that the doctor may order, vital signs, the amount of bleeding the patient should have, what's normal, the color change, where the hemorrhage protocol is listed in the patient's chart. So with my technology piece, we'll use the Omnicell, and then we're also going to use a fake patient, or like a practice patient, that I'm able to get from my clinical nurse educator, and she will be able to click through. That has all the order sets of all the providers, so each student can see and get practice on clicking through, initiating the hemorrhage protocol of what the doctor has ordered, or if we need to call lab, when do we call lab, when do we call an RT, just to kind of get those brains working. And I think it's a really good idea too for those experienced nurses and for the nurses who have just been on the unit for a very long time, to really just kind of have like a refresher, because of course policies and new technologies are coming out all the time, and our procedures may change, so it's very good, and policies may change, so it's very good to kind of stay up to date with that as well. So in relation to my assessment and evaluation skills or plans for this escape room, the biggest way I want to assess my participants is how well they can navigate through this escape room. Do they pick up that I noted that the patient has asthma, and we went to the order, the provider ordered Hemabate. Well, you can't give Hemabate to a patient who has asthma. So just little things like that I want them to try to pick up on, and that will just be one way that I'm going to evaluate them. The next way to evaluate the participants will be a pre and a post test. Very short answers, about 6 questions, 5 and 6 about that, and some are multiple choice, some are they have to write in the answer, and this will include risk factors, medications that are used for hemorrhages, and this, for the medications given, we also will discuss the route, how much is given, how often it can be given, things like that. And then at the end, I will have a little space for the participants to give me feedback, because I really want to be able to, look on their viewpoint to see what they think about it. I have used my clinical nurse educator and our clinical nurse 4 as my guinea pigs for them to read through it with me and tell me, okay, now when I say this, what do you think about this? Because I think for the next year or so, I really would like to be able to implement this escape room for the next year, possibly with not a postpartum hemorrhage, but with say resuscitating an infant after delivery, because you come to these competencies and everything's in a form of a PowerPoint, or you watch a video, but with this it's more hands-on. We're going to have a whole bunch of supplies and equipment for people to play with, so they can get their hands on it and really become comfortable with going through the motions and how to prepare their medications. We recently just had medications that changed. We used to have to mix it ourselves, but now it comes in a pre-mixed bag, which is wonderful. Our TXA